Welcome to Women's Healthcare. Today we will explore ingrown toenails causes, treatments, and healing. How to fix ingrown toenails fast. Ingrown toenails occur when the edge of a toenail grows into the surrounding skin, leading to pain and inflammation. This condition commonly affects the big toe but can occur on any toe. Causes of ingrown toenails. Improper nail trimming. Cutting nails too short or rounding the edges encourages the nail to grow into the skin. Tight footwear. Shoes that squeeze the toes can push the nail into the surrounding skin. Injury. Trauma to the toe can cause the nail to grow abnormally. Genetics. Some people inherit a tendency for ingrown toenails. Symptoms. 1. Pain and tenderness around the sides of the nail, especially when pressure is applied. 2. Redness and swelling around the affected area, indicating inflammation. 3. Infection. Signs include pus or fluid drainage, increased pain, and sometimes a foul odor. Treatment of ingrown toenails. At-home care. Soak the foot in warm water for 15 to 20 minutes, 3 to 4 times a day. Place cotton or waxed dental floss under the ingrown edge of the nail. Change it daily. Use pain relievers like acetaminophen or ibuprofen. Apply antibiotic cream and bandage the toe. Professional medical treatment. For a slightly ingrown nail, a doctor might lift the nail edge and place cotton, dental floss, or a splint under it. This helps the nail grow above the skin edge. For a more severe ingrown nail, the doctor may trim or remove the ingrown portion of the nail, often under local anesthesia. If the problem is recurrent, a more permanent solution might involve removing a portion of the nail and the underlying tissue, or matrix, to prevent regrowth. If there is an infection, the doctor may prescribe oral antibiotics to clear it up. Treatment of the hole under the nail. When dealing with an ingrown toenail that has caused a hole or separation under the nail, proper care is essential to prevent further complications. Clean the area daily with mild soap and water to prevent infection. Apply antiseptic solutions to the affected area to reduce the risk of infection. Do not apply pressure on the affected nail. Opt for open-toed or loose-fitting shoes to avoid aggravation. Look for increased redness, swelling, or discharge, and seek medical attention if symptoms worsen. Follow up with your healthcare provider to ensure proper healing and prevent recurrence. Post-treatment care. Avoid exposing the foot to dirt and moisture. Choose shoes that fit well and provide ample room for the toes. Protect the toe from injury. Watch for signs of the nail growing back improperly and seek prompt treatment if needed. Prevention. Trim nails straight across and avoid rounding the corners to prevent the nail from growing into the skin. Wear shoes that fit well and provide enough space for your toes to avoid pressure on the nails. Keep feet clean and dry to prevent infections. Be cautious during activities that could injure your toes.